Hi, this is Dr. Rahman, and welcome to Black Women's Health. It's all about you, and we celebrate the Black woman. Welcome. I am glad to have you here. Let's talk. I have a special guest with me today. Her name is Shirley. Shirley is a registered nurse. And if you don't mind me saying, Shirley is 66 years old and looks really good for her age. How are you today?
Thank you. I'm great. Thank you.
So I asked Shirley on the spur of the moment if she would share her steps to success, because when she came in for her annual visit, I saw that she had lost just about 10 pounds. And I asked her, how did she do it? So how did you do it, Shirley?
I changed my diet, basically. I always was I exercised, ran, and did dance class, but seems like that wasn't working. So when I changed my diet, it just seemed like I felt better, and I knew I was losing inches weight.
So tell us about your exercise program. It's a little different, I would say, for most women.
Well, for years, I've always done dance classes after work, Monday through Friday. And then on Saturday and Sunday, I jog. So that's what I've been doing for years. And depending on the weather and, I increase it or decrease it. If I'm off during the week, then I'll jog during the week too. So that's always been enjoyment for me.
Have you always been athletic?
Probably, yeah, I have. When I was younger, I used to swim, but after my third child, about in my 30s, that's when I started jogging. And it just makes you feel so wonderful, so I continue it.
And so you jog alone, or do you have girlfriends that you jog with?
I jog alone, yeah. Always in the daylight time, though, yeah. I jog alone. Because when I'm ready, I want to go, and so...
And how far do you jog?
Well, the whole total is like 5.5 miles, but I fast walk
up for you.
And then run back.
Did you decide this exercise regimen on your own, or did you read about it, or what made you decide?
When I originally started jogging, I was pregnant, and I started walking, and I was late, and the doctor told me if I started walking, that would help get the baby moving. So that's how I started. And then after I had the baby, I started, and then I added running to it. And the way that you feel afterwards is just, I don't miss a time to run. Like, I'm ready.
So in Philadelphia, they have the Broad Street Run, and they have the marathon, and they have the half marathon. Do you participate in any of those?
I have not, only because I go to church every Sunday, and that's something that I really enjoy. The Broad Street Run is always on a Sunday, but I've been ran for the Y and other different organizations. Yes.
Amazing. Very impressive. Very impressive. And again, I have to say, at age 66, we talk about black women don't exercise, but that's not true. And you're a living testimony to that.
Thank you.
Yeah. So, but the interesting thing about the story was that recently an article came out in the JAMA magazine, which is a professional organization for the Journal of American Medical Association. And they said, admittedly, the information that we're giving people is confusing. Should it be a Mediterranean diet, or should it be a vegan diet? Is it okay to eat meat? Is it not okay to eat meat? Should I drink dairy, or should I not drink dairy? Is milk good for me? Is milk? And it's really confusing. And this article basically said what we should be telling people is that they should eat less and exercise more. Just that simple. Eat less and exercise more. And you came into the office and you were a testimony of that you were now eating less and exercising more, and that's how you lost your weight.
Yes, definitely. I don't follow follow any specific diet. I just I cut out a lot of things that didn't make me feel good, which was the sweets, the breads, the rices, things like that. I eat a lot of vegetables, a lot of green vegetables. I enjoy vegetables. I eat fruit, fish.
So the interesting thing that you said was that you listen to your body. And what do you mean by you don't feel right when you eat certain things? How do you feel? How do you know this is good for me versus this is not good for me?
Afterwards, after I'm done, if I start feeling miserable and bloated, and then I know I need to stay away from it. And there were certain things, especially the sweets afterwards. Initially, they taste good and I enjoy them, but afterwards, I didn't feel well. And like even the same thing with oatmeal. I used to eat oatmeal with blueberries and walnuts, and I thought it was good for me, but I noticed afterwards I just didn't like the way I felt, so I cut it out. I just feel much better having in the morning protein like eggs or, the egg whites, avocados, and it just makes me feel so much more energetic.
So this should be a message to us all. We don't have to be confused by all the confusing information that's going out there. Eat less, exercise more, and listen to your body.
I agree with that. Yes, definitely.
Thank you so much. I
You're
really
welcome.
appreciate having you.
Sure. My pleasure.
So this is Dr. Rahman saying it's been a pleasure speaking to you, and I look forward to talking with you real soon. Until then, be well, be healthy, and enjoy life.